In this video, we will be demonstrating how to properly inject an EpiPen in a public setting. An EpiPen is used when a patient is experiencing anaphylaxis. Anaphylaxis is a rapid onset allergic reaction that can be identified if the patient presents with hives, swelling, or rashes on the skin. Other symptoms include shortness of breath, trouble speaking, and nausea or vomiting. When this happens, an EpiPen is used to inject epinephrine into the patient's thigh, which will reverse the symptoms of anaphylaxis such as opening up airways.
It is key to know that even if you have an inkling that the patient may be experiencing anaphylaxis, an EpiPen should be injected. For example, if a patient presents with shortness of breath, has an inhaler and an EpiPen, the EpiPen must be administered first. This is vital because the repercussions of an anaphylaxis attack are more severe than the repercussions of an asthma attack. It is also important to note that the person experiencing anaphylaxis cannot administer the EpiPen themselves, as they are not in the right state of mind and could harm themselves even more. To administer the EpiPen, you start by holding the pen up vertically with blue end facing the ceiling and orange end towards the ground. To remember this, the phrase blue to the sky and orange to the thigh is used.
Then, firmly grasp the pen between your thumb and index finger and wrap your palm around it. Remove the blue safety cap and swing the EpiPen into the lateral side of the patient's upper thigh. This can be done over clothing. It does not matter which thigh you inject. If you hear a click, you know you have injected it properly. Hold the pen in the person's thigh for at least 10 seconds before removing. Note the time it was injected. You must relay this information to the paramedics when they arrive. Once complete, put the EpiPen in a bag for safekeeping. This bag must be given to the paramedics when they arrive as well. At this time, make sure 911 is called along with the patient's family. This call can be done by another bystander if present, or by yourself after you carry out the rest of the procedure.
Next, lay the patient on the ground with their legs elevated above their heart. This ensures that blood can flow to their heart easier, which allows for better circulation. If a patient is experiencing nausea or vomiting, bring them to their side into recovery position. You cannot leave the patient alone at any time, as the symptoms may get more severe and they are not in a clear state of mind to take care of themselves. After 5 to 15 minutes, if the patient is still not feeling well, another dose of epinephrine can be given. However, you cannot exceed 2 doses as this can lead to high blood pressure, stroke, or even death. Once the paramedics arrive, give them the bag with the EpiPen and tell them the times the first and second dose, if needed, was given. The patient then must go with the paramedics to the hospital. They cannot go home as they must be monitored because symptoms may arise hours after. Finally, give yourself a pat on the back. You just saved a life.